Did you know your feet can tell a lot about your overall health? Yes, those two appendages at the end of your legs are more than just a means of getting around. They are a window to your overall well-being. It's true, our feet are complex structures. Each foot contains 26 bones, 33 joints, and over 100 muscles, tendons, and ligaments. They work in harmony to support our weight, help us balance, and enable us to move. They carry us through life, and they often show early warning signs of underlying health problems. For instance, conditions like diabetes, arthritis, and circulatory issues can manifest symptoms in the feet before anywhere else in the body. Many people ignore foot pain. They think it's just from standing too long or wearing uncomfortable shoes. But this pain can be a signal that something more serious is going on. They think it's just from standing too long or wearing uncomfortable shoes. However, persistent foot pain should never be ignored. It could be a sign of conditions like plantar fasciitis, bunions, or even more severe issues like nerve damage. But persistent foot problems can be a sign of something more serious. For example, swelling in the feet can indicate poor circulation, heart disease, or kidney problems. Numbness might be a sign of neuropathy, often associated with diabetes. It's important to pay attention to your feet. Notice any changes. Regularly inspect them for any signs of trouble. Look for changes in color, temperature, and texture. Check for any cuts, sores, or unusual growths. These changes might be pain, numbness, or discoloration. Early detection is key. If you notice any persistent issues, it's crucial to consult a healthcare professional. They can help diagnose the problem and recommend appropriate treatment. It can help prevent bigger health issues down the line. Taking care of your feet is not just about comfort, it's about maintaining your overall health. So give your feet the attention they deserve. They are, after all, a window to your health. Foot pain is incredibly common, but it's not normal. It shouldn't be ignored. Pain is our body's way of telling us something is wrong. Sharp, stabbing pain in the heel could be plantar fasciitis. This is inflammation of the tissue supporting your arch. A burning pain in the ball of your foot might be Morton's neuroma. This is a pinched nerve. And then there's arthritis. It often affects the joints in our feet. This causes pain, stiffness, and swelling. If you experience persistent foot pain, don't hesitate to see a doctor. Swelling and discoloration in your feet are major red flags. They shouldn't be taken lightly. Swelling can indicate a range of issues. These include injury, poor circulation, or even heart problems. Discoloration, like a bluish tint, can signal poor blood flow. Yellowing nails might point to a fungal infection, and redness, warmth, and tenderness could be signs of inflammation or infection. These symptoms warrant immediate medical attention. Don't wait for them to go away on their own. Diabetes can wreak havoc on your feet. High blood sugar can damage nerves and blood vessels. This leads to diabetic neuropathy and poor circulation. Diabetic neuropathy often causes numbness, tingling, and pain in the feet. It can also make it difficult to feel injuries. Poor circulation slows down wound healing. This increases the risk of infections. People with diabetes need to be extra vigilant about their foot health. Regular checkups with a podiatrist are crucial. Section 5. Foot clues for heart health. Don't ignore the signs. Your feet might seem like an unlikely place to look for signs of heart health, but they can actually provide crucial clues. Paying attention to these signs can help you catch potential issues early and seek the necessary medical attention. Believe it or not, your feet can provide clues about your heart health. The condition of your feet can reveal a lot about your overall circulatory system. For instance, changes in the color, temperature, and sensation in your feet can be indicators of underlying health issues. Cold feet, especially if accompanied by numbness or tingling, can indicate poor circulation. This is not just a minor inconvenience, it can be a sign that your blood isn't flowing as well as it should be. Poor circulation can lead to more serious health problems if left unchecked. This could be a sign of peripheral artery disease or PAD. PAD occurs when the arteries that supply blood to your limbs become narrowed or blocked. This can reduce blood flow to your legs and feet, causing a range of symptoms and increasing your risk of heart disease. PAD is a serious condition where arteries in the legs and feet become narrowed or blocked. This restricts blood flow. When blood flow is restricted, your muscles and tissues don't get the oxygen and nutrients they need, which can lead to pain and other complications. Other signs of PAD include leg pain when walking, slow healing sores on the feet, and a weak pulse in the legs or feet. Leg pain, also known as claudication, typically occurs during physical activity and goes away with rest. Slow healing sores can be a sign that your body is struggling to repair itself due to poor blood flow. If you notice any of these symptoms, it's essential to see your doctor right away. Early diagnosis and treatment can help manage the condition and prevent complications. Your doctor can perform tests to check your circulation and determine if you have PAD or another circulatory issue. Don't ignore the signs. Your feet could be telling you something important about your heart health. Section 6. Nutritional deficiencies. Can your feet reveal the truth? Our feet can sometimes reflect nutritional deficiencies. For example, a lack of vitamin B12 can lead to nerve damage. This causes tingling, numbness, and pain in the feet. Iron deficiency can lead to restless leg syndrome. This causes an irresistible urge to move your legs, often accompanied by uncomfortable sensations. If you have persistent foot problems and suspect a nutritional deficiency, talk to your doctor. A simple blood test can often identify any deficiencies. Section 7. A painful reminder. John's story of ignoring foot symptoms. John, a 55-year-old accountant, had been experiencing tingling and numbness in his feet for months. At first, it was just a mild annoyance, a slight tingling that he felt at the end of a long day. He thought it was just a part of getting older, something that everyone his age went through. He would often rub his feet, trying to get the feeling back, but it never seemed to work. He brushed it off as just getting older. He had a busy life with work and family responsibilities taking up most of his time. He didn't think it was worth worrying about. After all, he had more important things to focus on. One day, he stubbed his toe and didn't realize it until he saw blood. He was walking around his house, not paying much attention, when he accidentally kicked the corner of a table. It wasn't until he sat down and saw the blood on his sock that he realized he had hurt himself. Because of the numbness, he hadn't felt the injury. It was a strange sensation, seeing the injury but not feeling any pain. He cleaned the wound and put a bandage on it, thinking it would heal quickly. The wound, due to poor circulation, took weeks to heal. Every day he would check it, hoping to see some improvement, but it seemed to be healing very slowly. He started to worry that something was wrong. This landed him in the doctor's office. He finally decided to see a doctor, hoping to get some answers. The doctor examined his foot and asked him a series of questions about his symptoms and medical history. John was diagnosed with diabetes. The doctor explained that the numbness and slow healing were symptoms of diabetic neuropathy, a condition caused by high blood sugar levels damaging the nerves. This experience was a wake-up call for him. He realized that he had been ignoring his health for too long and that he needed to make some changes. He started to take his condition seriously, following the doctor's advice and making lifestyle changes to manage his diabetes. It highlighted the importance of paying attention to his feet. He began to check his feet daily, looking for any signs of injury or infection. He also made sure to keep his blood sugar levels under control, knowing that this was crucial for preventing further complications. John's story is a reminder to all of us to listen to our bodies and take action when something doesn't feel right. Ignoring symptoms can lead to serious health issues, but with proper care and attention, we can manage our health and prevent complications. Section 8. Listen to your feet. Key takeaways for overall wellness. Your feet are talking to you. Are you listening? Foot pain, swelling, discoloration, and other foot problems are not normal. They can be signs of underlying health issues. Remember, early detection is key. Don't ignore foot problems. See a doctor or podiatrist for persistent issues. Taking care of your feet is an essential part of taking care of your overall health. Section 9. Take charge of your health, your next steps. Have you experienced any unusual foot symptoms? Share your experiences in the comments below. And don't forget to check out my other articles for more health tips and insights. Your health is your most valuable asset. Take charge of it today.